Director for Family Investment at the Washington County Department of Social Services. Family investment, to be more specific, is food stamps, medical assistance, cash assistance, and emergency assistance for families with children. So we have a wide range of programs, benefit programs that help the citizens of Washington County. And so in November, we started to see some widespread changes because of House Resolution number 1. So I'd like to spend a little time today going over some of those changes and how they are affecting what we do and how they will be affecting what we do at the department and how it interfaces with the individuals that we help. If at any point in time you have questions, feel free to stop me, or we can also pick it up at the end. So, just a little idea of the background. These are some facts and figures. This is the totality of Maryland. In Washington County, we have between 11,000 and 12,000 individuals on benefits. But this is the state of Maryland. And you can see the size of the population that we serve across the state, as well as the total amount in SNAP benefits that we issue annually to Marylanders. We average about $180 monthly SNAP benefit per person. Next slide, please. So, one big and the biggest change is around HR 1 is the implementation of work requirements around our food supplement program. It says at the top, expanded ABOD work requirements. I'll tell you what ABOD means. I don't expect you to remember it. It means able-bodied adults without dependents. It essentially means adults without children that are not disabled. We have used this language for a long time. ABODs means something to the people that do the job, but for the people that don't do the job, it's easier to think of it as time-limited benefits. All our benefit programs are time-limited to a certain extent, and if you don't meet the requirements to stay on the programs, your time ends. So with ABOD, the work requirements are in place now, that if you aren't meeting specific criteria and you fall within these groups, you are not eligible for benefits. If you are not disabled, if you're not working 20 hours a week on average, this group was added, this is expanded. Before, we've had ABODs for a very long time, but HR 1 expanded it. It lowered the age before, it lowered the age, and changed some things around it, and expand the footprint of people that are now under these requirements. And these are some of the groups that have been affected with the new rules. These are the ones that have been impacted by the new rules. So if you're an adult 18 through 64, you do not have a child younger than 14 in the home, before November 1st, ABOD wouldn't have applied to you. You could have, if you were eligible for all other benefits, you would have been okay. Now, if you fall into that group and you're not disabled, working 20 hours a week, meeting any other qualification for it, you can receive 3 months of benefits over a certain 36-month period. Once you receive those 3 months, you can no longer receive. We'll talk more about that later, especially because the clock is changing around some things here. But just a general overview of it is that if you don't meet those requirements, you cannot receive food stamps. Next slide, please. So one of the big things was expanded ABOD work requirements. I know this group also interfaces a lot with refugees and the immigrant population, and so there are also been some changes around this. Now, these slides are specifically say SNAP, but it also affects medical assistance. For our immigrant population, before, if you were a refugee or you were granted asylum, an asylee, you were eligible for benefits. Now you also have to be a legal permanent resident. So if you're an asylee, but you have not met legal permanent resident status, you are not eligible for benefits. Doesn't mean others in your household cannot be, and they can, but you yourself specifically, if you don't meet the criteria, you are not eligible. Go ahead.
Are there children eligible?
Yes.
Okay.
If their children are eligible and they're documented, children are okay. But if I am an adult and I am not a legal permanent resident, I cannot receive.
Okay.
If the children come in do not come in under some kind of immigration status, they cannot receive. If that makes sense. Cindy?
What is the likelihood that an adult would even come and ask for service?
I can give you two answers from that. I can give you an answer before November 1st of 2025, and I can give you a slightly different answer for now. In the past, we've had a number of individuals in that circumstance where adults were not eligible, but the children would be. We have quite a few households like that. They're very upfront about it. We are here for the children. We understand we cannot receive. That's no problem at all, but we are here for the children. As HR1 work requirements have tightened and some of the other events of the world have changed, we have found some households are less eager to interface with us around the benefits because they fear more long-lasting ramifications from accepting our benefits. No, that is not true as it currently stands, but that is how people perceive it, and we try to combat that perception. We try to meet people where they are. We do a lot of work in the community, specifically around schools. We are part of a kind of a statewide school program where we go out to a number of schools within the community, send a worker out there and meet with families one-on-one. So we've tried to, one, reduce the problems of coming to us. You know, it's also a strain on people's finances where if you live in Hancock, that's a long way. If you live in Cascade, that's a long way to come see us. So we're trying to find ways to go to people and alleviate their concerns, whether it's around immigration status or whether it's just around, that's a long way for me to go to get into the office, and that's, you know, gas isn't cheap. So you'll see us have a lot of widespread community events, but we're also working in schools. And I would also say to this group, if you have any events or you know of any events, please just send it my way. Our contact info is here at the end of the presentation. And we can arrange to have someone there if there would be a need. When we're at places, we do applications. We can help individuals through the applications. We can also just answer general questions. So if someone is active, but they have a question about their active case, what their next steps might be, something like that, we can answer those in real time as opposed to them coming in to see us, emailing us, calling us, whatever it might be. So as the needs for our clients have changed and the ways that we need to interface have somewhat changed, we're more than ready to meet individuals where they need to be met at. So that is a big change as far as the legal immigration statuses. Now, some individuals are currently active under those guidelines. There are some asylees and refugees that are currently active. But when they are next up for redetermination, that will change. So you may hear from individuals that say, I was active in September of 2026, but in October of 2026, I'm not. Why aren't I anymore? It's because cases usually have a year certification. They have a certain certification period, and we will keep you in your status during that certification period. When it's time for a recertification, the new rules would have to kick in, and therefore you would be subject to those new rules. So your benefits can change, not only monetarily, but from all the rules around it. The last one is more of a procedural thing. When individuals come to us, we need certain documentation. So if you're requesting food stamps, we would need your income. We would also need your housing information, which could include your rent statement, but it could also include your utilities. So another big change where it says households without an elderly or disabled member no longer automatically receive the standard utility allowance. That just means that in the past, households were receiving that standard utility allowance. That's just credit we give you on your case for paying paying electric or some kind of heating or cooling source. Doesn't mean you can't receive it, it just means now before we can give it to you, you have to have an electric bill or some kind of proof that you're responsible for paying it. So it's more of a procedural thing, but it is, requiring clients now to provide a little bit more information than they had before. We're not necessarily picky about how we receive that information. You can text it to us, you can email it to us, you can walk in, however, again, we're always happy to meet customers and we don't want to put too much of a burden on them to get the information back. But the sooner clients get the information back, the sooner we can do their cases for them. Next slide, please. To go back to the work requirements a little bit. So Now individuals must be working, volunteering, or in an employment and training program for 20 hours a week. So volunteering, working, training programs do count, and you can combine to get those. So you don't have to get your 20 hours all from one source. You can volunteer for 10 hours, do another 10 hours somewhere else. But if you're not doing 20 hours a week, we cannot give you benefits. The point under is kind of procedural on what we need to do on our end. And then that last bullet point is just touching on something I mentioned earlier, that you can only receive SNAP for 3 months in any 36-month period if you're subject to those ABOD requirements. The clock is a rolling clock and it runs every 3 years. And the clock changes on July 1st of this year. So, if I'm an individual,
Are there particular types of organizations that qualify as where people can volunteer?
No.
Okay.
No, we do have to have some kind of documentation that we do, so that would require an organization or someone from the organization to say, this individual volunteered X number of hours a week. And they would need to turn that documentation into us so that we could take the necessary steps. But volunteering is volunteering, and the case for that. And if we need more information about the organization or anything like that, we would follow up with the customer. But that's a good question. Thank you. So, as I said, the rolling clock is changing again on July 1st. What does that mean in the grand scheme of things? If I was an ABOD, and let's say I was a single adult who was not working and did not have any children, and I could not receive benefits right now, if I had already received my 3 free months of benefits within the last 3 years. July 1st, the clock resets, which means my eligibility resets. So on July 1st, or any point in time in the next 3 years, if I reapply, yes, I'm still considered an ABOD, but I get 3 free months. At that point, if I were to come in hypothetically July 1st, I would get July, I would get August, and I would get September. I would get the full benefits that I'm entitled to. October 1st, if nothing has changed, if in those 3 months I don't find work, I don't find volunteer hours, I don't find some combination of something that meets the ABOD work requirement, my benefits would end October 1st. And if nothing changed again in the next 3 years, I would not be able to receive benefits until the clock resets in 2029. If I receive in July, August, September, but in April of 2027, I find employment, I can come in and say that I now have this job, I'm working 20 hours a week, here's my income. If you still meet all other eligibility criteria and your income does not render you income overscale for the program, you're meeting the ABOD requirements, you can now receive food stamps. So we are working very hard, especially within the window that we have right now, to re-engage some individuals that we have not had the opportunity to engage with over the last 3 years, let's just say, to get them enrolled in some kind of work program, volunteering program, whatever it would be, to keep their benefits going past those 3 months. We have a very active job center at our agency. What our job center does is it helps individuals, one, look for jobs. We also have resume help, and we've had a lot of success just in the last 6 months. We found a lot of individuals jobs, and if not, if we can't find you a job, we help you craft a resume. So we found about 22 individuals jobs since June of this year. We've crafted 55 resumes that people can take out in the community. You don't have to be a client to utilize those services, but yeah, we do refer our clients to utilize those services if they're interested. Sorry, I'm sure I'm getting pinged from some other thing. But yeah, I can tell. Anyway, so yeah, as we engage with these customers, we try to find ways to assist them as best we can. If an individual is disabled, we have to have some kind of documentation for that. So individuals, if you're found obviously disabled from Social Security or Social Security disability, these rules don't apply to you. If you're an individual that is not actively receiving some kind of governmental disability benefit, if you can find a doctor or a medical practitioner that can attest to your disability, that means they have to fill out a form and complete information, we can exempt you from these and keep your benefits going. Any questions around any of that? It's a lot. It's a lot for the people that do this every day. So I'm sure it's a lot for the people that are, helping as much as they can in other venues. Go ahead.
Are these thresholds different from pre-COVID? Because I know when COVID hit, that's where, prior to that, you volunteered if you were in housing and you received certain benefits, or is this completely new?
Parts of it are completely new and parts of it aren't. Before COVID, this work requirement, ABOD, has always existed on and off. There have been some times that we have not been under these rules, and there have been times that we have been. Obviously, in the thralls of COVID, it was waived. When it came back after October 1st of 2025, the scope expanded. It raised the age limit that you had to be. So before, it was not 62. It was lower than that. It raised the ages. So yes and no. It's always kind of been there on and off, but it's expanded in scope, and it has involved other populations that were previously exempt from these. In the past, if you were homeless, you were exempt from these work requirements. That is no longer the case. Homelessness is not an exemption. Former foster children, for example, used to be exempt as well. That's no longer the case. So there are a few groups that, whereas before would be exempt, not so much now. And I'm sure the biggest one we've seen is our homeless population. That homelessness is no longer an exemption.
Are there ways for nonprofits and congregations to create that volunteer work or particular protocols as to what it needs to be?
There's not necessarily protocols of what it needs to be. Each organization, has their own kind of scope of volunteering, as it were. But if an organization were to take it on, we would need some kind of point of contact that we could refer back to, that we could refer customers to. If we were to say, go to this entity as a resource, and we can hook you up with some volunteer hours, we'd have to have some coordination on our end if we were going to make the direct referral, and we're happy to do that. But clients also find their own places to volunteer as well. So it's a little bit of both, but if an entity of any would be interested in that, yes, that could be something that we could refer customers to. We would be able to say, I understand, where you are now, but if you're interested in keeping your benefits going, here's a place that could help. So yes, there's not necessarily a certain way that has to be, but if it's something that we're kind of working together for, yeah, we'd be more than happy to kind of pursue a formal referral thing. Any other questions around this? I think there might be a next slide. Yeah. This speaks to kind of your questions. What it was before, and what it is now. So as you see there, before veterans, homeless individuals, and former foster youth under 24 and aged out were exempt. Now that is not the case. Whereas before, if you were an adult and had a child under 18 in the household, you were exempt. Now it's a child under 14. So it expanded. We brought in new populations. next slide, please. So these are just ways to contact and ways to apply online. Our Washington.fi and Washington.verify are essentially one and the same. So if you had a question or a client had a question, you could utilize one of those resources. We use Washington Verify as a way when we interface with customers and we say we need your pay stubs back and they don't want to bring it in, we ask them to email it to us at Washington.verify. If you email us at the wrong thing, we're not going to send it back and say try again. We're happy to take it, but it's just a different way that we kind of sort it for our work stream. Don't be afraid to reach out to any email address up to and including my own. It's joshua.bond@maryland.gov. If you have any questions, I'm happy to help you facilitate whatever that may be. And then up top is how to apply online. That is our online application portal. We often tell people, because the web address is somewhat long, so we often just tell people to Google Maryland food stamps and it will be the first thing that comes up. It is an online application that customers can do on their phone. The web portal has been redesigned and it's much easier now to use on customers' phones or your own phone. Doesn't mean you have to file an application online. We do have to have some kind of formal application, but it doesn't have to be done online. You can do paper. We take walk-ins every day, so if you were to walk in now and ask to be seen for food stamps, we could do that for you. And we also have a number of paper applications out in the community. So if you work with an organization and you'd like to have some paper applications on hand in the off chance that you'd like to distribute them to the individuals that you work with, please just let me know and we can get those to you. We got plenty. And we can also arrange a way to get those back from you, which is, you can email them or we've sent people to pick things up from organizations before. So we're willing to meet anyone wherever they can to get access to these benefits.
I have a question.
Mm-hmm.
What if dad is working but is not on the table, he gets paid on the table, how do they prove it?
So in that case, we would need something from dad's employer. I understand they're under the table, but if dad's employer were to write a letter that said that dad works 30 hours a week at X number of dollars an hour and makes this amount, we're okay with
If
that.
that person applies to that and follows through with that letter, they have 2 children and they're not married, does the unwed mother go on that policy or that application, or they only claim the children?
If the mother is not a food stamp household or only individuals that live in the house with you.
She does live in the house
So
with them.
she would have to be on that case.
Okay.
Then, excuse me, then we would talk about how old are the children, and because that would impact the mother, then it would be, does the mother have some kind of exemption? So it can go a lot of different ways, but
Children are 2, 1 and 1 on the way.
if the children are under 14, she's exempt, so, yeah. And then we would encourage her, when the other child was born, to let us know as soon as possible, and we can add that child to the case to get them additional benefits. Any other questions? It's a lot, but we're happy to help anyone navigate through it, especially the people that are helping those in the community. So please just let us know how we can continue to help out. And we're always available. And if sometimes people will get letters from the state with some confusing information, that's okay. We see them every day, and sometimes they're confusing to us. That's okay. But send them our way, and we will get them clarity about their status at that moment and what they need to do or what they don't need to do. Because I know that sometimes the letters aren't, as easy to parse as people would prefer them to do. And so, to help, please just let us know, and we can give the answers. Any other questions around this, or just anything in general? A lot of these rules do not apply to our families with children cash cases. So we haven't talked about TCA, temporary cash assistance. That is a different program that falls under different guidelines than SNAP. Yep, sir.
Just a comment, thanks for working through all the ways to make sure people get services.
Yes.
Thank you very much. Thank you. Yeah, the state of Maryland, and, Washington County have been trying very hard to limit the harm across the state, while also knowing that we have to follow the rules. And so we're trying to find different ways to limit the harm as much as we can, and continue to look for different ways to do that. It's going to look different across, every county, across every state, but we are open to anything to limit the harm. So, all right. Thank you very much for your time. Thank you.
Hi, how y'all doing? My name is Leanne. I am a child welfare supervisor over at the Department of Social Services. I currently supervise our workers who recruit our foster parents, so that's what I'm here to talk with y'all a little bit about today. The first couple of slides we might go through kind of quickly just so I can stay on track, but just let me know what you think. All right, so what is foster care? So Washington County DSS, we are focused on promoting the safety, well-being, and permanency of kids in Washington County. Sometimes there are circumstances that exist in a child's home that does not allow for them to stay in that home for a number of reasons. Our goal whenever we have to step in and implement foster care of any kind is for that to always be temporary. We always do anything that we can to keep children in their homes with their parents and caregivers, with their family members, if we have to step in and utilize foster care. The goal is generally reunification, which means that we're working with those parents, caregivers, family members to get those kiddos back into that home as quickly and as safely as possible. Sometimes that may not be possible, and then that's when we start looking at other permanency options. So currently, we have about 164 kiddos in care, and those kids are from Washington County. Those kids range anywhere from 0 to 21 years of age. And while those kids may have entered foster care in Washington County, they do not all currently live in Washington County. So we have children placed throughout different counties and jurisdictions in the state. The largest group that we currently have in foster care are ages 0 to 4, followed by the second largest group of kiddos ages 5 to 10. We have multiple demographic groups and representations for those kiddos and families that have entered into foster care. So one of the biggest needs that we see with our kids who are currently in care is that we have sibling groups. And so our sibling groups are anywhere from 2 to 4 kiddos currently. And so one of our largest needs for our foster care population is a way to keep those kiddos together. Foster care is a lot. Coming into foster care and being separated from your siblings adds another layer onto that. So currently I think our largest sibling group is a sibling set of 4. They were able to be placed together, however they're no longer in Washington County, they've been placed in a different county. So whenever we have kiddos enter into care, we have what we call a placement hierarchy. So first and foremost, like I said, we really want to do anything we can to help absolve safety issues or concerns in the home and keep those kiddos with their parents, with their family, and not bring them into foster care. Whenever we do have to remove children from the home for safety reasons or well-being concerns, the first place we look is family. So if there's a way to maintain those children in their family unit, then that's what we're looking to do, whether that's in Washington County or outside of Washington County. The second place that we look to place children is in foster care with our licensed and trained foster parents here in Washington County. So currently out of those 164 children that we have in care, the largest amount of that population are currently in what we call treatment level foster care homes. Those foster homes are generally run and overseen by different agencies in the community. For Washington County, Sanmar is our largest agency that license our treatment foster care homes. And then there are a few of those agencies throughout the state. Here in Washington County, our regular foster homes kind of house our second largest chunk of kiddos that have been brought into foster care. So, placement matters for our foster kiddos. So at the time of removal or any placement change, we work very hard to keep kids placed in Washington County. When we're unable to place children or youth in kinship or a Washington County licensed home, they may often be placed outside of Washington County. The process of coming into foster care, like I was saying, can be pretty traumatic for that kid, can be traumatic for the family. And then adding those different layers on of having to be potentially removed from your community, family members, and kind of put into a completely different environment can add on to those layers. Family and local placement allow for children to maintain their vital connections with family, friends, their school and community resources. The more we can keep them connected, the better chance they have for success and achieving positive outcomes in the future. There are some new federal initiatives that have been recently introduced. So A Home for Every Child, which has been led by the Administration for Children and Families, aim to balance the foster care system so that every state achieves a ratio of 1 licensed foster home for every child in care. This really focuses on preventing system reentries, prioritizing kinship care, and expanding and retaining our resource homes that have been licensed. The other initiative that has been recently introduced is Fostering the Future, led by First Lady Melania Trump. This is designed to improve long-term stability and success for youth in foster care. This really centers on education, vocational pathways, and wealth-building opportunities. There are also state initiatives. The Moore Miller administration has implemented sweeping foster care reforms, investing to end the practice of children staying in hotels, establishing nationwide standards for one-on-one care, and increasing kinship placements. So there was a time that if we had an emergency placement, that we may be able to use a hotel as a temporary respite, or while we were looking for placement, we might have kiddos with us at the office. After this bill has been passed statewide, that is no longer an option for us to use. So immediately when children are sheltered, they are going into some form of licensed placement, whether that be their kinship placement, a foster home, or a placement outside of our community. So in our community, resource parents serve a critical role in the child welfare system by providing safe, temporary, or permanent homes for children in need of stability. Beyond providing a physical residence, they act as dedicated mentors and essential liaisons, navigating complex systems of healthcare and education to ensure children receive necessary services. By creating nurturing environments, resource parents actively promote healthy child development and support overall physical and emotional well-being. A key component of their work involves facilitating family reunification efforts whenever possible, and working to maintain and strengthen vital kinship ties. Furthermore, resource parents foster broader community engagement and participate in vital peer support networks to share knowledge and build a resilient caregiving community. So we have, with our foster parents here in Washington County, they have support offered through the department, and they have also created their own support network. It's a very unique experience to be a foster parent, whether that is short-term or long-term, and so they have found that by creating their support system and additional resources that they can tap into whenever they have youth in their care has been extremely helpful. So the process of becoming licensed to be a resource home, we want to know everything to make sure that we are helping to provide safety for children. There are a lot of background checks that come into play whenever you're applying to be a resource family. So you have to be at least 21 years of age. You have to be a U.S. citizen or a legal immigrant. For Washington County specifically, you have to be a Washington County resident. You have to be financially stable. You have to have safe and stable living arrangements, adequate home space, a willingness to work with families, and you have to go through different background checks. So that means we're going to check to see if you've interfaced with our child support system, our CPS system, state and federal background checks are completed, there's fingerprinting that's completed, and you're checked also through the sex offender registry. In no way, shape, or form do we want to remove children from an unsafe situation to place them into an unsafe situation. So it definitely can seem like a lot at first whenever you become a resource parent, but there's very good reason behind that. Recruitment, that's one of the main reasons that I'm here today to chat with you all. So we're actively working on growing our resource home population in Washington County. As I touched on a little bit ago, there are more times than not where we have to place Washington County kiddos outside of Washington County. And so that's where we're asking for your help at. So if there's an opportunity for us to come and chat with congregations that you're a part of or groups that you're a part of, we would love to have that opportunity, because being able to increase our capacity for resource homes in the county will allow for our Washington County children to remain in Washington County, to preserve that community, to preserve that family, and really just overall go towards those more positive outcomes that we really want for our kiddos here. If you choose to engage in being a resource parent, or you know someone that is willing to do that, we do offer training and support. So there is a training that we do, it's called our MTDC training, that lasts for about 4 or 5 weeks. It's once a week, and you come in and hang out with our home finders and learn more about what being a resource parent in Washington County looks like, in addition to learning about some of the challenges that you might face with some of our kiddos and learning how to deal with that. We have a mentoring program. We offer respite services, we offer trauma services, we have quarterly lunch bunch meetings, we have support and education groups for our foster parents and our kinship families. We do family celebrations, we have different clinical supports that we can offer our families, and there is, like I was mentioning earlier, a local league of foster parents that are always more than willing to open their arms to any new folks that we have to help provide support. That about wraps it up. So our big ask today, like I was mentioning, was just, we'd like an opportunity. We wanted this opportunity, and thank you so much, Kathy, to chat with all of you, to present information about what becoming a foster parent looks like. And like I said, at your congregations or groups that you're a part of, we'd be more than happy to come and set up information, come and talk with your folks about what it would look like to be a resource parent, or what it would look like to help provide different kinds of supports to those kiddos who are in foster care or their families in Washington County. We're always looking for resources, tangible and intangible, so we're pretty much open to any idea to work creatively with you all to help our community in this way. So that's all I have. Any questions? Okay. All right. Thank y'all.
Thank you so much to both Leanne and to Josh. Just a note about the foster care. So when Mark and I met with Tiffany, the director, last week, she shared that there used to be there were at one point 80 foster families in Washington County, and right now there's only 40. So they really have a strong need. That's why they're placing them outside of Washington County, as Leanne said. So, on your tables, there's a sign-up sheet for more information. So if you would like someone from DSS or be willing to have somebody from DSS come to your congregation and speak, whether it be in a service or a special second hour or something like that, then they'd be happy to do that, because we know that probably most of the folks in this room are not the ones who would be the foster parents, but you might have folks in your congregation who would be interested. So please just sign up if you would be willing to get more resources from them or have them come speak in your congregation, and they'd love to. And there's also one flyer on each table if you wanted to take something back, and I think we've got a few more flyers over here if you're interested. We could probably get those electronically too. We're going to send out the presentation via our newsflash and Facebook and all that jazz. So if you all have resources you can send me electronically that we could send out with those, that would be great, because then we can share that a little bit more widely as well. And so thank you again for coming.